Electroconvulsive therapy, or ECT, is a procedure in which electric currents are directly administered into a patient's brain, inducing a purposeful seizure. ECT has been known to reverse some symptoms in patients, providing improved conditions in cases of mental illness. In its early forms, it was often administered without anesthesia and in high doses, resulting in significant memory impairment, fractured skull bones, major confusion, and other complications for many patients. Today, ECT is still used in some cases to treat major depression, severe mania, catatonia, or aggression and agitation in people with dementia. It is generally seen as a last resort, and in most cases must be specifically requested by the patient. ECT is administered through 2 silver dollar-sized electrodes on the sides of the head. While it is not known exactly why the induction of seizures alleviates some mental health concerns, many patients report positive effects after several treatments, including reductions in anxiety and depression. For decades, ECT was used to treat aberrant behavior, anything out of the ordinary, including but not limited to addiction, shoplifting, alcoholism, masochism, transvestism, and homosexuality. Tens of thousands of transgender and homosexual men and women were sent in for treatment by family members, law enforcement officials, employers, or military officers, and many of them were involuntarily committed to institutions. In many cases, permanent damage was done, resulting in lifelong brain damage, trauma, and mental illness. In another form of shock therapy, medical professionals claimed that with a combination of therapy, ECT could work to, quote, reinforce sexual preference, decondition child molesters, and decondition frigidity, end quote. Electric shocks were delivered to the hands or genitals of the patient while they were shown pornographic photos in an attempt to provide aversions to the displayed images. In many cases, the patients were instructed to deliver their own electric shocks, sometimes in religious settings, such as the school Brigham Young University and many others, and were made to believe that the power of the shock they were self-administering would directly relate to the effectiveness of their treatment, and thus to the way religious leaders or God viewed their success rates. Both types of ECT resulted in medical damage and psychological trauma for many of those who received the treatment. ECT is still practiced in rare cases, though it has long proven to be ineffective in altering sexual preference or gender identity, and research has shown that it universally does damage to these patients. Unfortunately, ECT was only one of the many types of cruel medical procedures forced upon LGBT people over history.